and welcome to Senior Circuit. My name is Ashley Speliotis. I'm the interim director at the Somerville Council on Aging, and today we're welcoming Elaine Miller, who's a regional Shine director. It's just about time for open enrollment in October, and Elaine has graciously been our guest today so she can tell us a little bit more about the Shine program and what open enrollment is. So welcome, Elaine. Thank you for being here.
Thank you so much, Ashley, for asking me to be here. It's perfect timing. As you mentioned, during open enrollment, people will come to the Somerville Senior Center with many questions, excuse me, and you'll be able to direct them the right way. And happy to be on this interview today.
Thank you. Why don't we get started by actually talking about what is. It's actually an acronym for serving the health insurance needs of everyone, but what does that really mean?
Well, it means that it's a national program, and in other parts of the country, they refer to it as the SHIP program, Serving Health Information Needs of People. Shine is a program that really serves any Medicare beneficiary regardless of age. So we work with people that are Medicare eligible at over age 65 and under age 65 with a disability. It's a free program, and the backbone of the program are state certified Shine counselors who train under the Executive Office of Elder Affairs here in Massachusetts. They receive extensive training of 40 to 60 hours. And following that, they're mentored by an existing Shine counselor for an additional 20 hours. And then they're placed in the community to help people with Medicare questions.
Right. I mean, they go through a lot of training because Medicare and open enrollment is a huge topic. So there is quite the extensive training. And at the Council on Aging, we have 2 Shine counselors. This year, you'd be meeting with Natasha and I am. Our social workers available to assist. And at the Council on Aging, we work with a lot of people when they turn 65 or a little bit after when they're signing on to Medicare. It just seems like a overwhelming time for a lot of folks. And how do you see Shine counselors playing a role when somebody's signing on to Medicare?
I think Shine counselors would be really the first place to turn for someone that's turning 65 and not knowledgeable about their choices after they leave their employer. Most of us have been accustomed to having an employer group health plan, and 6 months prior to turning age 65 is really the ideal time to set up an appointment and talk with a Shine counselor. Right now, our counseling due to COVID is being conducted over the phone and virtually using Zoom. But we walk people through Medicare Part A, Medicare Part B, what types of supplement work with their Medicare, what are the costs, because some people do tend to think Medicare is free and it's not. And we also take a look at people's health situation and the prescription drugs that they might be taking, because that can really affect what they want to choose in terms of a healthcare plan. We're impartial and unbiased. We don't work for a health insurance company like Blue Cross and Blue Shield. So we can really give people all the options without swaying them in one direction or the other. We just try to work with an individual and find what's best for them.
Yeah, I think a lot of what makes it overwhelming in the decisions is, like you mentioned, that there are different parts to Medicare. A lot of folks think like, oh, I'll sign on to Medicare and it's one sheet or one piece of paper. But you mentioned Medicare Part A and B, and why don't you tell us a little bit about what those parts are and how you would get complete coverage under Medicare?
So when you turn age 65, you have a 7-month window to join Medicare Part A, and that is no cost to you. And it gets you into the Medicare database. And during your work life, you've paid FICA taxes, and Medicare Part B, there is a cost share. And right now, the portion that comes out of your individual Social Security check is $144.60. So Medicare A and B were never really designed to cover 100% of your health care. Roughly, they cover 80% of what happens to you. Medicare Part A is inpatient care, and Medicare Part B is outpatient services and different therapies like physical and occupational therapy. You would be responsible for 20% of the cost of a particular test if you did not have a Medicare supplement, which they sometimes refer to as Medicare C or Medicare Advantage plans, and that picks up where Medicare leaves off. It covers your deductibles, your co-payments when you see your primary care or a specialist, and portions of your lab work. So if an individual just joined Medicare Part A and Medicare Part B and paid their $144.60 per month, and they had an MRI ordered as a result of a fall, the cost to them out of pocket would be about $400 for that test. And a lot of people would find that kind of bill really hard to swallow. So it's good to have additional coverage. And if individuals are in good health, they may want to look at a Medicare Advantage plan. And if individuals like to have a lot of flexibility over their health care, they want to see a certain specialist, they don't want to change doctors, they like to go to a particular hospital, a traditional Medigap supplement is more suited for people that want that kind of flexibility. And there is a premium for that, which our Shine counselors can sit down with individuals and go over. We can either use the Plan Finder tool online, or we can do it in written form, whatever's easiest for the consumer to understand. But there are costs to healthcare. And if you do choose for a traditional Medigap supplement, you will also be buying a prescription drug plan. And the drug plan costs can range from $14 a month to about $80 a month. It's not really all a one size fits all because, as you know, Ashley, in your work at the senior center, we see many people that have chronic health conditions and they're taking expensive medications. So it is really important to sit down with a Shine counselor and run through a list of their prescription drugs to find out what the best plan with the lowest premium would be for them. Because each of the companies can tier their drugs in a different way. So something that Harvard might charge $1.50 for, Fallon might charge $21 for.
Mm-hmm. Yeah, I mean, I think you said a lot there, and that's where the questions come up, because a lot of people say, oh, I'm going to sign up for Medicare, and then they go down or through the portal with Social Security and they sign up for Medicare Part A, but that really means that they've just signed up for some coverage while they're inpatient, or 80% of being in the hospital. And
Right.
then when they sign on to Part B, they've signed up for outpatient services at 80%. And then there's so much more to think about, the other 20% of coverage and that prescription coverage, the Part D plan. And I think that's a lot of what Shine is able to go through, to talk with people and say, oh, right now this Part D plan will work for you, but maybe in the years to come, another Part D will work for you, or maybe an Advantage plan, or maybe an Advantage plan is not to your liking. So there are quite the few options out there. And I know a lot of times, because things are so separated with Part A, Part B, the supplemental plan, and then the Part D plan, we hear a lot at the council that if somebody's not taking medications, they forego having a Part D plan. But what would your advice be to that?
Well, if someone's in really good health and they're just early retiree, 65, I would advise them to join Medicare A and B and pick up one of the inexpensive Part D plans, which can start at about $14 a month. They would then self-insure if they were to have lab tests following a physical. Another option would be for that individual that's in good health, doesn't take a lot of medications, to look at the Medicare Advantage plans, which cost you the same amount. It costs you the $144.60 that you pay for your Medicare Part B. They start at zero premium, and they offer a drug plan, plus a lot of fitness benefits and wellness benefits that seniors would like, including reimbursement for hearing devices. If you're discharged from the hospital, 7 days of home delivered meals. They give you eye exams and reimbursement towards eyewear, and they offer up to $1,500 in dental care. And the physical fitness programs don't necessarily need to be based at a gym or at a YMCA. They can be a yoga class that you sign up for, Pilates that you sign up for in another location. There's a franchise called Title I Boxing. I don't know if many of our seniors would do that, but those kinds of fitness programs are reimbursable under the Medicare Advantage plans.
Yeah, I think in the beginning you were saying that you would still advise for somebody, if they didn't go with the Advantage plan, to sign up for one of the lower cost Part D plans. And I mean, I know when folks come to the Council on Aging, we say something similar because also a little known fact is that sometimes there's penalties. And if you don't sign up for that Part D plan, even if you're not taking any medications, more than likely, somewhere down the road, you're going to need a prescription. And when that day comes, there'll be a permanent penalty attached
Exactly.
for that Part D plan.
And that's a very good point to make to the consumers. The same is true for Part B. If people don't initially defer Part B, when they join Part A, there could be a penalty, and it multiplies based on the number of years. And if you can't prove to Medicare that you've had creditable coverage under a spouse plan, for instance, for your prescriptions, then you would be penalized for not having a Part D.
Yeah. They're important things to remember because sometimes when we make decisions, we are looking at the here and now. And, even $14 a month can be a cost savings to us, but a year or 2 years from now, it may not be as easy as when you need that prescription right away to hop on to a plan. And the same as you were saying for the Part B, that you might not need outpatient health insurance right when you turn 65 or right when you end with your employer sponsored health insurance. But when you do need it, then there will be penalties and there will be wait times. And that's what we're all hoping to avoid for you.
And a lot of people think because they're covered under a spouse plan that's still working, that they don't have to do anything. And that's where they end up having the penalties and being in situations that they don't want to be in. So Shine is a free service. We have a wonderful counselor in Natasha Naeem there at the Somerville Council on Aging. We have counselors throughout the area, Arlington, Cambridge, and 18 communities basically here in the Minuteman service area. So it's worthwhile to speak with a counselor when you're on the verge of considering retirement. And we're also starting to see many people who have been affected by unemployment due to the COVID situation. They are 65 and they were laid off, and chances are kind of unlikely that they'll be recalled back. So they know nothing about Medicare because they anticipated working another 5 years
Mhm.
with their employer group plan. So they're calling the Shine program pretty often to talk about Medicare, what it is, how they enroll in it, how much does it cost, and what can they do to keep their costs down while they're collecting unemployment benefits.
Sure. I mean, I think Shine is very important when people sign up or are interested in signing up. The time has come to sign up for Medicare. A lot of what we see at the Council on Aging is people who have been on Medicare for many years, but during open enrollment, they seek us out and they look for a comparison or to change their Part D plan during this open enrollment time, which starts on October 15th. And you mentioned a little bit about the plan finder. Could you kind of go into a little bit more detail of what the
Sure.
plan finder is and why it's important to review your prescriptions every year?
It is important to review yearly, and there are many tools for computer savvy people that are coming out of the workforce to make use of in their own homes, particularly now during COVID when a lot of us don't want to be out and about. The plan finder can be found at the Medicare.gov website, and the Medicare.gov website is really the only site that I would recommend for people to look at in terms of accuracy. What we ask people to do prior to open enrollment, when it does get very busy over that 7-week time frame, is set up a mymedicare.gov account and write down your username and your password. And when you do have an appointment with your Shine counselor scheduled, it would be important to bring along a list, which your pharmacy can provide, of your medications and the dosage and frequency, so that we can run the plan finder for you privately, or you'll be able to plug your prescriptions into the plan finder yourself. So
Right, because as you mentioned, there's, what is there now, 26 prescription drug plans around there?
there are 26
Plans.
and there are 30 Medicare Advantage plans. And the nice thing about the plan finder is that it puts everything on one page. It does a comparison based on your zip code and based on the medications that you're taking and your lifestyle, and gives you the exact out-of-pocket costs. So Shine counselors can help you run that, can help consumers run that but we're not going to senior centers during COVID. So that is our challenge this year. And we'll be doing all remote phone counseling. So the more tools that individuals can make use of online on the internet, the easier it will be.
Yeah, exactly. We at the Council on Aging are happy to help you as you walk through the steps on your computer, or you can call us and we can run the prescriptions for you. And I think you mentioned a little bit earlier in the show that what the plan finder does is, like you mentioned, it puts everything on one page. It tells you your yearly cost and your out-of-pocket cost, but it compares the plan exactly like what it's entitled is. So it compares not only your costs between plans, but it can also tell you the different costs based on which pharmacy you go to. And I think that surprises a lot of people that maybe at one pharmacy, it will be $10, but down the road at the next pharmacy, it might be $8. And
That's really good point. Yeah, they do add up. Another point that you're raising too about the pharmacies is that not all pharmacies, your corner pharmacy might not even be on the plan. So if you don't want to drive to Hannaford, or you lack public transportation, you want to make sure that you have a CVS or a Walgreens or a Rite Aid around the corner that the Medicare Advantage plan accepts.
That's right. I think a lot of what people do with the plan finder and why they come yearly to see us as Shine counselors is try to have a little bit of cost savings for them, which is very important. And the other thing we hear a lot about is that people are trying to avoid the donut hole. And that always seems like a little mystery of what the donut hole is. And if you have an easy way to explain and share with folks, sometimes it's preventable, sometimes it's not, but what is this thing called the donut hole?
The donut hole. I don't know how it got that name, but basically what it is most Medicare drug plans have a coverage gap. So, and this year the coverage gap, I'd like to refer to the donut hole as the coverage gap. I think it's easier to understand. And the Medicare coverage gap this year, you need to spend out of pocket $4,020 on your meds. Then you reach what they call the donut hole or the coverage gap, and you'll be paying full cost of your medications. And that is for a certain period of time until you reach that amount of money that the company wants for you to contribute towards your pharmacy. You'll pay about 25% of the cost of the brand name drugs and almost the full price of the drug will count as out-of-pocket costs. But if you're a diabetic, it can be very expensive. If you're paying full cost for your diabetic insulin supplies, for instance, it can exceed $1,000 a month. And I know individuals that we've counseled that have hit their $4,020 maximum benefit within the first 3 months of the year, and it's calendar year. And then they're in what they call the donut hole, and they're paying out of pocket for another 3 months in order to get back on their plan.
Right. So what it sounds like is exactly as you mentioned, this gap, and that $4,000 or about $4,000 limit is really set across the board. So it's not based on your insurance plan. It's kind of another little known fact that you learn at Shine Counseling, that attached to every Part D plan, there is this threshold, and once you meet it, you fall into that donut hole where your costs go up, and then once you meet another threshold, your costs go back down a little bit. And I think that's great. What the other thing about Shine Counseling is that they do have some ways like Prescription Advantage or other programs that you can meet with them and discuss if you would qualify for. And I don't know, we have a few minutes left. If you could address what Prescription Advantage is.
Well, Prescription Advantage is a Massachusetts-based program. It's a very simple application. There is income eligibility, but it's a little bit higher than for most public benefits. And you can also do a cost share. It could cost you $200 a year. And Prescription Advantage is what people do when they've reached that $4,000 threshold. They apply so they can have some relief for their drug coverage. There are also a number of free programs that people are really not aware of. They're not well advertised. One is called Needy Meds, and they're based in Gloucester, but it's a national organization, a nonprofit. If you are low income, you can apply over the phone, and they will connect you with the pharmaceutical companies so that you can get your prescriptions filled at no cost. And there are other programs, the Mass College of Pharmacy, for instance. You can contact them directly, and they will match you up with the pharmaceutical company that typically has a foundation, and they'll make a case for you. I can't afford my diabetic medication, or I'm on outpatient chemotherapy, which is going to bankrupt me. They help connect people to the foundations that will give them no cost prescription coverage.
Right. I mean, I think just like we started this conversation, everybody is very unique and their needs are unique. And that is the sole purpose of the Shine Counselor, is to meet with you and discuss your unique needs and use some similar tools across the board, but to really see where you fit best in this kind of confusing system. And I just want to say thank you for being here, Elaine. I'm sure it raised some more questions than even what people started with, and that's why we're here still this year at the Council on Aging. We will be doing just like at Minuteman. We'll have FaceTime meetings, Zoom meetings, and over the phone meetings to help you all during open enrollment, which starts just a few weeks away in October. So thank you.
You've been a great partner. Somerville, Cambridge, in that entire area, you've been great partners, and thank you so much for this opportunity. And if you'd like, I could give out the local Shine number or ask that people call the Somerville Senior Center if they'd like to set up a Shine meeting directly.
Yes, they can call us directly, and we'll do our best to have all your needs met and have an appointment made during open enrollment. Thank you once again, Elaine, and we'll see you all at home next month.
Awesome. Thank you so much.